Hello, how is everyone doing? I hope everyone is doing great and fine in this nice weather outside right here, okay? But anyway, we are in the studio. But you'll probably will be wondering, why are we doing here? Alright. Today, we have Dr. Edwin.
Hi everyone.
And me, Dr. John, okay? Because we have been working for some times in our dental field, and we have a lot of people talking, probably questioning us about their dental health. That's the reason why we are having this, what we call the Smileway facts, so that you can actually learn more about your dental health.
Yes,
right?
that's very true.
Yeah, and today we are talking about infection, isn't it?
Yes.
And can you tell us something more about infection, like Dr. Edwin?
Yes, so as you all know, there is bacteria in our environment. So it's everywhere and it's so small that you are unable to see it using the naked eye. So usually bacteria also present within our body, not just in the natural environment.
Yeah, because you see, like if you're talking about infection, right? Infection, one of the most things that actually cause infection is bacteria that you were saying.
Yes.
All right. But there's also another one which is what we call virus, isn't it?
Viral
There's also
infections.
virus, like what's happening right now, COVID, you know, is virus and infection. And also there's also another type of infection which is called fungal
infection.
But what is the difference, Dr. Edwin? Can you tell us more about virus and bacteria?
As we know, bacteria, they contain cell wall.
They contain cell wall. Basically, they are their own living organism themselves,
Yes.
isn't it? All right. So that they have so once they come inside, they can live by themselves inside
And multiply inside our body.
Yeah.
Yes.
So if you're talking about virus, it's slightly different, isn't it?
Yes, virus, they require a host organism.
So that's the reason why, like COVID, right? It requires a host, and it goes inside the person's body, and
Yes.
then it mutates at the same time, isn't it? Because it comes into the RNA and DNA. I mean, that's a bit deep, but it goes into a genetic code, and then sometimes it actually mutates itself.
Yes.
That's what happens to the COVID itself.
Yes.
Right? Could you tell us more about what kind of infections are there in our mouth?
So for infections in our oral cavity, there are few different types. They are usually localized to the gums or to the teeth, or it can also affect our bones. So for infection of our gums, we mainly call it gingivitis, which is the swelling of the gums. If the one that affects our teeth, we call it caries. And the one that infects our bones, we usually refer to it as periodontitis.
Yeah, so because there's a lot of a wording there, okay, so basically all it started, gingivitis and periodontitis is one of the most occurring infections we see in Malaysia here. A lot of people come in and they have a lot of what I call the tartar, the calculus, which is already inside the mouth. What if we do not remove it, it can actually cause bleeding gums.
Yes.
And what actually happens inside the tartar itself?
So the tartar is a collection of bacteria that actually sticks to the surface of your teeth. So when it sticks to the surface of your teeth, over time it gets hard and it becomes very hard to remove through manual brushing techniques.
Yeah, that's the reason why some of our patients, right, they say that, I brush all day long, and then why my gum is still bleeding, and I brush a lot, why still the dirt is not out?
Yes,
That's the reason, because it has already adhered to your teeth for so long, and we only are able to actually remove it with ultrasonic scalers.
Yes, we have these scalers that vibrate at high speed, which will actually enable us to remove all this dirt that sticks onto our teeth.
I see.
Yes.
Yeah, because you see, what happens if we do not remove these? Because these dirt that actually adhere to our teeth, it gives an environment for the bacteria to thrive. So that means it's more bacteria inside your mouth. As we know that our mouth itself, one surface, a teeth contains 5 surfaces. One surface itself, there is around 100,000 to 1 million bacteria inside. Talking about different species also is inside there. But bacteria can be good and can be bad. But in most important sense is that the whole entire mouth, there's billions of bacteria. So we want to reduce the amount of bacteria to actually not to have so much infection, isn't it?
Yes.
So by taking those dirt out earlier, it doesn't reach to the bone, isn't it?
Yes.
That's
so
what we're talking
as
about,
long
the
as
periodontitis.
yes, true. As long as we eliminate the source of infection in the early stages, we can prevent subsequent
More
conditions
problems
that are bad
Yeah.
for the body. Yes.
And also something to know that there's a lot of people saying, every 6 to 8 months we need to clean our teeth, right?
Yes.
And that's the reason for it. We do not
Yes.
want things to be accumulated.
Yes.
And at the same time, the dentist will be able to take a look at what kind of problems you have and actually let you know in the future. Why? Because as we know, prevention is better than cure.
Yes,
Isn't it?
yes, that's very true.
There's also other types of infection inside
Yes.
the wisdom tooth, right?
Yes, as you know, wisdom tooth is the last tooth that is situated in our oral cavity. So this wisdom tooth is kind of tricky. Sometimes it does not erupt in its usual pattern. It might hit the front teeth, which causes pain, and if left untreated, it may lead to infection. So these are all the things.
These are all the things that, that's the reason why we take an X-ray at the same time.
Yes, we
Because,
take X-rays.
that's why whenever you come to the clinic, don't be discouraged when the doctor said, you know what, let's take an X-ray.
It just helps us detect any potential problem that you may have with the wisdom teeth, and also helps us predict our treatment plan during when we want to remove the wisdom teeth.
Yeah, it's really true. Why? Because there is one patient that came in when I was attending that patient. The person, she didn't have any problems. She came and then she didn't have any problems of her mouth, and everything was fine. I looked at it, everything was clean, but just for precaution, okay, she said that her wisdom tooth was not out yet.
Okay.
So we wanted to take an X-ray. So we take an X-ray. There are many ways that, to tell the truth, there are many X-rays out there, but all you need is just one big X-ray. You can see everything really.
Yes.
It's called the OPG. So once we take the X-ray, what actually happened? We did see her wisdom tooth was actually banging the front tooth.
See.
Okay, but that's not causing pain. But in the future, it might. Okay? But the thing is that is not what intrigues me.
Mm-hmm.
What intrigues me is that she ended up to have big black patches
I see.
some other places. You see.
An incidental finding, so we can
Yeah.
detect that using our OPGs.
Yeah, so
Yes.
that means we can detect some other stuff, and we have to deal with the infection, which
Yes.
is over there at the same time. Yeah, there's also one of the biggest question that a lot of people has been asking. That if they have tooth pain in the beginning,
Yes.
then all of a sudden they found out there isn't any more tooth pain at all, and they think that the whole entire thing is healed.
I see.
Yeah.
Yes, so this toothache, we call it as a chronic toothache. So it's chronically irreversible pulpitis. So when the caries, the bacteria, actually attacks the teeth, and it actually goes through the layers of the teeth, which eventually reaches the pulp of the teeth, which contains all our nerve vessels and blood supply for our specific tooth. So once the bacteria enters that layer, it will result in the death of the tooth. So it actually kills the tooth.
Yeah.
But that's why you feel the initial sharp pain, but slowly, gradually over time, it will start to reduce. But that doesn't mean the infection has actually stopped. The bacteria can actually continue to produce and multiply itself, resulting in spread of the bacteria to other places of our body. Yes, so
that's what you were talking about, the root cause of a problem. You see,
Yes.
that's why a lot of people, they always wanted, just like one of the book I've written, magic. I call it. People always want a magic pill.
yes, yes.
They want something that they eat, then everything is okay. But by right, there isn't such magic
There is no
pill.
such thing.
So, for example, even though you take antibiotics or painkillers,
Yeah.
it's basically just a reduce of that what do you call it, the
Bacterial level.
bacterial level. That's all it is. But the main cause is still there. If we do not eliminate those main cause, it actually grows to become bigger.
Yes.
And you were saying that pulpitis, when it becomes pulpitis, that's when the bacteria attacks the nerve. it gives you acute pain. That's why you feel the really pain.
Yes.
Then after that, you don't feel that much pain. It becomes chronic. A lot of people just leave it. I don't recommend leaving it just like this. Why? Because it's going to give you a lot of problems in the future. Because bacteria itself down there, which is underneath the bone, can become a cyst.
Yes.
As we know it. All right. And when it becomes a cyst, it's going to require more surgical procedure to take it out.
Yes. So a cyst is actually a large collection of foreign bodies, not just bacteria, but it also contains waste products that your body produces to try to kill the bacteria. So all the dead cells, all the accumulation of fluid there actually results in the formation of the cyst. And the cyst is actually enveloped by a layer. So that layer keeps the cyst, and it may always expand to other structures.
Yeah, for example, like when your immune system falls,
Yes.
then that's when it expands. It actually invades other places.
Yes.
Yeah. And there is also other types of infections which is inside the mouth. Oh yeah, okay. Also talking about smoking.
Ah, I see, smoking.
Yeah.
So smoking, there are few things that smoking causes into our oral cavity. It irritates our oral mucosa, the surface of our gums. So that usually causes acute inflammation, which you can see redness of the gums. You can see there's a special feature called smoker's palate in smokers. It's caused by the heat that radiates towards the palate of our mouth.
And that's why sometimes we can detect the person is actually
a smoker or not.
isn't
Yes.
it? Yeah.
And also for smokers, they have more of a tendency to have plaque and tartar buildup. That means their teeth will easily stain. You'll see black spots, and they have the very heavy smokers, the breath. Yes.
So if let's say if you have an infection, the body itself starts to fight off the infection itself.
Yes.
And that's the normal procedure. All right. So for example, if you have a wisdom tooth infection, let's just say, or you have a tooth which is already dead, the infection is dead. What actually happens is that the body itself produce white blood cells.
Yes.
Okay, it contains neutrophils and monophils to go. Actually, it's basically your own body's armies. They actually go there and they attack those bacteria.
Yes.
So just imagine if there is an army of fighting together. Actually, what happens? There will be some debris all around.
Yes.
And those debris is what we call the pus.
Mm-hmm.
Right? And it takes time for the pus to be
Expelled from the body.
And that's the swelling. That's what causes swelling. That's the reason why sometimes when we do a wisdom tooth extraction, there is a swelling there. Not to worry, in about 3 or 4 days it will subside itself, right?
Yes.
With the antibiotics and painkillers itself.
Yeah.
So if you do not get rid of the infection, what actually indirectly can cause in our body?
So the infection that it causes is sometimes the bacteria, it travels through our bloodstream. It might reach the valves in our heart. We call that acute endocarditis.
Mm-hmm.
So when it affects the valve, we are unable to pump blood efficiently, which results.
So basically, indirectly, it won't straightly give you a disease, but indirectly it will actually cause more harms to your body because our body works as a system. All right, it keeps generating as a system. So, so talking about that, what are the things that we can do to actually improve your immune system, especially right now, since in this time of COVID time? Basically, just be healthy, isn't it?
Yes. Of course, regular exercise is one of the best ways to maintain our health. Mm-hmm. But recently, there's a thing called probiotics.
Okay.
So probiotics, it actually provides us with good bacteria. Yes, this good bacteria can populate our body, which actually helps us prevent bad bacteria from actually attacking
fighting off the bad
yes.
bacteria at the same time.
This bacteria will actually compete with the bad bacteria. So as long as we have sufficient good bacteria, we won't be infected by the bad bacteria
and
that
also,
easily.
Good to take more fruits, right? Because fruits itself clears off a lot of debris and dirt inside our teeth. And at the same time, drink a lot of water, all right? Especially in this kind of season. I would say vitamin C is also good.
Yes, vitamin
Don't
C.
overdo your vitamin C, please. A lot of people just keep taking vitamin C all the time, and we understand, it's going to give you some problems in the future. All right. So there you have it. Okay. If you have any questions or anything, you can always let us know. Okay. You can always comment below.
We will answer your questions as well as possible.
Yeah, we will definitely answer your questions, okay? And if you really want, you can actually go to Smileway there, and we can, Dr. Edwin or me, or even we have Dr. Belinda and Dr. Michelle will be very, very happy to actually see you. All right.
Sure.
If you like this video, we will have more. Not to worry. If you like this video, okay, please do share and like, and so that more people will know more about their dental health. All right. I'll see you guys next time.
Thank you very much.